Now we need to start it with heart block. We have three kinds of heart block: first degree heart block, second degree heart block, and third degree heart block. And we have two types of second degree heart block: Mobert's type 1 and Mobert's type 2. Now we start with first degree heart block. First degree heart block. How we know that there is first degree heart block in ECG? We have RR. The distance between RR is regular. PR interval. PR interval is constant, but more than normal. More than 5 millimeter. Normal, we have normal 5 millimeter, about 5 millimeter. When there is more than 5 millimeter, it means that there is first degree heart block. When RR is regular, when PR interval is constant but more than normal. Every P is followed by QRS complex. Every P wave is followed by QRS complex. That will be the first degree heart block. It's normally found in athletes. There is no need of treatment in first degree heart block. Okay, when there is first degree heart block in ECG, when RR is regular, when PR interval is constant but more than normal, and every P is followed by QRS, that is the first degree heart block. Causes of first degree, first we check in ECG strip. Now here you can check that distance between RR is regular. There is no short and lengthen of R wave between distance between two R wave. There is equal distance between each R wave, and there is normally up to here, but it is large than 5 small square. PR interval is more than 5, but it's constant every time. It is constant. Check this. It is prolonged from normal, but it's constant every time, same. And every P wave is followed by QRS complex. P wave is followed by QRS complex. P wave is followed by QRS complex. So this is first degree heart block. What are the causes of first degree heart block? Acute MI on the top. First degree heart block. Acute MI on the top. Ischemic heart diseases, acute rheumatic fever, myocarditis, hypokalemia when there is vomiting, so electrolyte imbalance, which cause first degree heart block. And there are some drugs which also cause first degree heart block. There are beta blockers, calcium channel blocker, and digoxin. Hope you remember all this. Now we move toward second degree heart block. Second degree heart block. We have two types: Mobert's type 1 and Mobert's type 2. Type 1 and type 2. Now in type 1 there is progressive lengthening of PR interval followed by QRS drop. What does this mean, progressive lengthening of PR interval? This is QRS T wave. This is P wave. No, it is progressive lengthening. Just check its length. PR. No, here is PR lengthened than first one. Here is the length. It means it's progressively lengthening of PR interval, and there is one QRS drop. It's P wave, again P wave. It is P wave, It's P wave. No QRS. It means one PQRS is drop here. So this means Mobert's. It means there is a QRS drop in Mobert's type 1 after progressive lengthening of PR interval. Type 2, there is PR interval fixed. Lengthen or shorten or normal, but it's fixed. But P wave not followed by QRS until there is QRS drop. RR wave is irregular in Mobert's type 2. PR interval, just like this one, PR interval is lengthening in type 1, but this is constant in Mobert's type 2. Until a QRS drop and then this P wave. It means this distance, and this distance PR interval is fixed. There is no changing in PR interval in Mobert's type 2 until a QRS is drop. In type 1, progressive lengthening with a QRS drop is called Mobert's type 1. Second degree heart block Mobert's type 1, when there is PR fixed and suddenly a QRS drop and RR wave is not regular in Mobert's type 2. This is called Mobert's type 2. Mobert's type 1 causes are physiological in athletes, digoxin and acute MI. Causes of Mobert's type 1 is physiologically in athletes, digoxin and acute MI. Usually need no treatment. And Mobert's type 2 causes are coronary artery disease, acute MI, digoxin toxicity, electrolyte imbalance. Such type is serious and may lead to third degree heart block, so need temporary pacemaker. Hope you got it. Here is Mobert's type 1. Here is PR interval small, progressively increasing. This is Mobert's type 1 until a QRS drop. Here is drop of QRS. Here is Mobert's type 2. Just check this distance. Check this one. It's all fixed. PR interval is fixed. Suddenly a QRS complexes drop here. So distance is not increasing progressively. It is fixed. So it is Mobert's type 2. Now we move to third degree heart block. In third degree heart block, there is no association between P and QRS complex. No relation between atria and ventricular. Atria contract by themselves and ventricle contract by themselves. That is third degree heart block. It means when there is difference between contraction of atria and ventricular, there is no relation in between these two, then there is no heart pump. P is at constant and equal distance, while RR is also equal but slower. RR is also equal but slower. Causes हमारे पास क्या हो सकती है थर्ड डिग्री हार्ट ब्लॉक की? MI में हो सकता है, इन्फ्लेमेशन में भी हो सकता है, डिजॉक्सिन में भी हो सकता है. ट्रीटमेंट हमारे पास जो ज़रूरी है वो पेसमेकर है. थर्ड डिग्री हार्ट ब्लॉक में क्या होता है? P और QRS कम्प्लेक्स के दरमियान कोई एसोसिएशन नहीं होती. नो रिलेशन बिटवीन एट्रिया एंड वेंट्रिकुलर. ये चेक कर ले, यहाँ पे आप देख सकते हैं ये RR का जो डिस्टेंस है वो रेगुलर है. P वेव जो हमारे पास है वो भी रेगुलर आ रहा है, लेकिन P वेव खुद बन रहे हैं, R वेव खुद बन रहे हैं. P और R वेव का कोई एसोसिएशन नहीं है. P वेव के बाद कोई QRS कम्प्लेक्स नहीं है. P वेव के बाद कोई QRS कम्प्लेक्स का वो नहीं है. ठीक है, और QRS कम्प्लेक्स के बाद कोई P वेव नहीं है. तो हाँ, P वेव एट्रिया खुद कंट्रैक्शन कर रहा है, वेंट्रिकुलर खुद कंट्रैक्शन कर रहा है, दोनों के दरमियान हार्ट ब्लॉक हो चुका है, तो कोई एसोसिएशन नहीं है. ये देख लें, PR इज नॉट फिक्स्ड, PR इंटरवल नॉट. RR रेगुलर है और PP रेगुलर है. P इज इक्वल टू QRS. नो रिलेशन बिटवीन P एंड QRS कम्प्लेक्स. ठीक है। लेकिन आर वेव जो है नॉर्मली से थोड़ा स्लो होता है, तो ब्रेडिकार्डिया भी हमारे पास होता है 3rd डिग्री हार्ट ब्लॉक में।